Good morning. My name is Opara Oluchi Udoka, and this is my mom, Mrs. Victoria Ayalechi Opara. We are from Nigeria, the eastern part of Nigeria, Imo State. We left Nigeria in September, first week of September, on recommendations to Apollo Hospital, Hyderabad, Telangana, India. And so far, so good. The journey has been a very smooth one, from the point of entry to accommodation to transport and to the hospital. We had a first encounter with Dr. Prasad, and after which we were referred to Dr. Naveen, gastroenterology. So that's where the journey started. Dr. Naveen, to the best of my knowledge, began this whole journey and made it easier because I know her looks, her medical history from Nigeria. I know what it was. I know how serious it was before we came. But we had hope, seeing the environment, the nurses, the doctors, the cleaners, everybody. The neatness of the environment, first of all, the neatness. I was telling my mom that, how come a hospital doesn't smell like a hospital? I haven't perceived anything here. I haven't perceived the injections, tablets. Normally, hospitals have those smells, but it's not the same here. That was where I started having hope. I said, we are in a home, not a hospital. And in the home, people are not sick in the home. People are sick in the hospital. So claimed healing from the point of entry. So Dr. Naveen and his group, they started with us, and I appreciate them very much. Their department, gastro, they kept to their promise. They did all they could. And finally, we had a break after their own procedures. We had a break and went to Dr.TPS Bhandari. And that place, the doctor, I don't know how to thank him. He wasn't just a doctor, he was a father to me, and somehow, partially a husband to my mom, because he eventually took up every duty. Apart from being a doctor, he took up duty of a husband, a father, an uncle, anything you can think of. He took Dr. Bhandari and Dr. Swami, and they started their own procedure too. He gave me hope. I just told him something. I told him, doctor, please, I want to go back to Nigeria with my mom. I don't want to go back with her cups. I don't want to go back without her. Please, do everything you can. He told me how critical the surgery is and how difficult it is. But he said he could do something, that we should be hopeful. So they did all they could. Yeah, there were difficulties along the line, but they managed every single situation. Also, the people at the ICU, all the doctors in the ICU, the nurses, the cleaners, the transport, the wheelchair people, everybody, the people in the lab, people. My mom's name became a household name. Victoria, everybody's Victoria. You fine, Victoria? How you doing? Patient name Victoria. Where is she? Have you eaten? Have you had lunch? Everybody cared. Everybody. Then there was a woman who came our way. Of course, it's her job, but I also know people who have these jobs and they don't do it how they're supposed to do it. Mrs. Isaac Sanjana. She received us, and she made the journey very smooth too. For every time we had appointment in the hospital, she books it, she communicates with the doctor, the billing, time to pay, she goes, make sure we don't overpay or underpay, make sure nobody gets cheated along the line. And even in the apartment we stayed, she would call, are you comfortable? Do you want to come to the hospital? Should I send ambulance? You want to change dollar? Should I call Bureau de Change for you? Every single thing, Apollo took care of it. And I haven't seen this type before. Yes, I must say the truth. I haven't seen this type before, even where we are coming from. It's not this way. Nobody has attended to us in a hospital in this manner. In fact, I have always had hope. Yes, God is the ultimate healer. But men looking at the environment, looking at the doctors, the way they talk to you, nobody shouts in Apollo. Nobody insults a patient, no matter how bad the patient looks, no matter how the patient is not reacting to medications, the patient is not helping the doctors to make it work. They still find a way to make sure things get right. Even when they know this thing could go bad, this thing could go left, you wouldn't even know. It's just me being so attentive. I could tell what is going on in their mind. But they have a way of managing pressure. They have a way of managing attendance sensitive nature to patient's reaction. So I noticed that in the ICU, even when my mom was almost as if it's over, they didn't want me to know that this thing could happen, right? They kept giving me hope. Dr. Bhandari, I keep saying it, he kept giving me hope. He told me everything is fine. Yeah, when they did this, whatever the result is, he'll tell you, don't worry, I will handle it. Everything is fine. He kept using the word, everything is fine, or everything will be fine. There was never a time he gave me a false hope. He always tell me, let's be hopeful. And after everything he does, he said, thank God, don't thank me. Thank God, don't thank me. So I am proud of Apollo, and yes, it's not even expensive. Yes, from where we are coming from, after the whole exchange, it could look expensive from our angle. But coming here to touch Indian rupees, it's very, very affordable. The medications, everything. I'm comparing to where we are coming from, because I haven't seen a hospital where somebody will pay for a procedure, the minor procedure, for as low as 10,000, 15,000 Indian rupees. In my country, we're talking about hundreds of thousands for a minor procedure, as minor as endoscopy. As minor as endoscopy. It runs in thousands and millions. And these are two different currencies. But if things were equal dollar-wise, I don't think Apollo is expensive. No, it's not. It's only expensive for us because we are doing an exchange with a lower kind of currency. But if we were in India and earning in Indian rupees, it's quite affordable. So I recommend Apollo anytime. I recommend. Yes, we only had one challenge. We only had one challenge, and it's normal to happen. Feeding. The food, yes, we are from the continent, Africa, we are from Nigeria, as far as Nigeria. So I don't expect our food to have any kind of, I don't expect it to taste alike or feel alike. That was where we had a challenge, just the feeding. The feeding, that is the only challenge we had. You know, when they bring their food with taste, because of the different kind of spice, it's not giving us the Nigerian taste, and sometimes become aggressive. And the people in the kitchen, they wouldn't feel offended. Sometimes they come, we didn't eat their food. Peacefully, they take it back to the kitchen. Nobody questions you, madam, you're wasting the food. Or no. Nobody questions that. Happily, they know, they understand what we are struggling with. Our taste board is struggling with the taste of the food. Not because it's not a nice food, but because we are coming from a different part of the world. So I appreciate everybody. I appreciate the admin, the doctors, the nurses, cleaners, the people who kept. I didn't clean my mom for one day. For as long as she was admitted here, I never had that cleaned her body or whatever it is, feces, urine. They took care of it. In all happiness, nobody frowns at anything, nobody shouts, nobody gets irritated, nobody says, why are you doing this? Why is she vomiting? Nobody says that. I am judging because I know where I'm coming from. So whatever Apollo is doing is okay. We appreciate every of their efforts, and we say thank you. We are grateful, and we hope for. Yes, my mom has recovered, and we hope for. We wish and pray there wouldn't be any reason for such kind of you know, it was very, very overwhelming and traumatic for me and my people back home. But we appreciate every effort, and we are most grateful to Apollo, and in everything we thank God. And that is it. On our way back to Nigeria, we are grateful. Thank you very much.